And can you hear me okay?
Yes, I can.
Okay.
Yes, Mayra Overstreet Galeano. I am a family physician and I work in a couple of different places, but my main clinical work is at Med North Health Center, which is a federally qualified health center. I've been at Med North. I literally just a couple of days ago had my 10-year anniversary here. I am the chief medical officer, so I do a lot of administrative work in the CMO role, and we are the only federally qualified health center in the county of New Hanover, and we are located in the north side. I am also a resident of the north side. Federally qualified health centers are required to provide a sliding fee scale so that we can see people independent of their insured status. So we see a pretty diverse patient population. The patient population that we serve is about 30, 30% African American, 30% Hispanic Latino, and then 30% not that. And there's a refugee population as well that's across those three groups from all over the world. And there's definitely some of the patient population that is historically from the community because we see people independent of their insured status. And we also have a grant to be able to provide care for patients who are experiencing homelessness. We have a very robust integrated behavioral health team. And so we have a pharmacy on site. We have a dental department here as well. And we provide care for patients across the age spectrum and do some prenatal care procedures here. And we have counseling and psychiatric service. We try to work in a team-based care setting, which also includes community health workers. And those community health workers, along with care managers, help patients navigate many of the systems external to the clinic that have a significant impact on health outcomes. There's a pretty large body of research that shows that at least 90% of health outcomes are determined outside of what happens in clinic walls. So we try very much to understand the milieu in which patients live and have to navigate to be able to attain their best health. I remember one day I had a new medical student working with me here in clinic, and a patient came and is from she was from Wilmington, and she was likely affected by some mental health conditions, likely depression, certainly anxiety, and a lot of what was affecting her health was because of concerns regarding violence exposure that is affecting her neighborhood. And there wasn't really a lot that I could do to really address the immediate concerns for her, really for her safety. But it was definitely a huge, the concerns regarding her safety were a huge determinant of her blood pressure reading for that day, many of the symptoms that she was experiencing, and just really not feeling like she had a whole lot of control over even her living situation, which really, I think, helped the student really help them understand all those external forces that contribute to determinants of health. And I think for me, before I went to medical school, I actually did environmental health research. And as an immigrant, I moved to the U.S. when I was 9. Or my family and I moved to the U.S. And I think they just made me very aware of of culture and community, and how communication works, and how the environment that people exist in can greatly influence their experience of the world. And I think I have just maintained some of those insights throughout my careers. And I was glad to be able to find a place where I could really assist them to work within a community, especially the historic North Side, and be able to do that in a way that is informed. Federally qualified health centers, there's a requirement that we have a governing board that is at least 50% active patients. Having that voice and perspective is definitely a powerful one. When I think about the North Side, it's interesting because it's the North Side and also some areas just south of the North Side that are part of the historic African American population. I think it's a little hard for me to separate a few thoughts. So certainly access to equitable, affordable housing can make a huge difference. And are you familiar with the term structural violence? I'm sure you're familiar with redlining and just the history of institutions that have been involved in creating and maintaining policies that have made it really impossible for everyone to have equal access to services. If I think about just focusing on the North Side, or thinking about the neighborhoods that you guys are comparing, the affordable housing would definitely make a huge difference. If I think about the ideal state, there would be a kind of return to, actually, I don't know that it would actually be a return to, it would be maybe the creation of an environment where people interact in a way that allows us all to see each other as humans. There are lots of these echo chambers that are negatively impacting our world, unfortunately. But I think that there are persisting policies that prevent everyone from really being able to see the humanity. And I think that makes it easier for greed to contribute to how resources are distributed. And that may be getting a little too abstract or vague. I think that if we were to be able to figure out how important it is to have policies that can really support affordable housing for everyone with access to education, thinking about shifting from a situation where you have to have a car to be able to meet all your family's daily needs or your own daily needs, and really think about restructuring our transportation in a way that really allows everyone to, just even having the opportunity to interact in public transportation and in educational systems, that would make it a little bit more likely. And if we can focus on kind of like the basic human-to-human interactions, where we look at each other in the face and are able to do a grocery shopping in similar places, have access to quality produce, and think about even doing gardening together. All of those types of simple interactions can probably go a long way toward allowing everyone to attain their best health.
Learn more about Shoresides at shoresides.org.